Here's a sample difficult CASPER question and the proper response. Now, let me just read this scenario for you. You're a first year medical student on a hospital rotation. During rounds, you notice a senior resident hastily discard a used needle into an open wastebasket instead of a sharps container. Moments later, a housekeeping staff member, Alex, begins emptying the basket. Prompt number one: what is the most pressing issue in this scenario? Question number two: what immediate action would you take? Question number three: how would you handle the situation if the resident becomes defensive? So let's go through this together. Response to question number one: identifying the most pressing issue. The top priority is immediate safety. Alex faces a risk of needle stick injury that could transmit blood-borne pathogens. Obvious, right? You have to be able to identify that for any type of CASPER question. Number two: what is our immediate action? We need to use our if-then strategy. If Alex is about to lift the basket, then I would step in right away and politely say, hold on a second, there is a used needle inside. Let me dispose of it safely first. I'll use gloves. I'll transfer the needle into a sharps container and document the incident. If not, I will alert the appropriate staff to dispose of the needle safely or do so myself. It's safe to do so, or minimally, I'll remove the basket and secure it somewhere so no one can touch it until there is a way to safely dispose of the needle. Now, what's the response to the question number three? How would you handle the situation if the resident becomes defensive? After ensuring safety, I'll quietly address and privately, I'll have a conversation with the resident and say something like, hey, I noticed the needle went to a regular trash. I'm concerned for housekeeping safety. Can we review the sharps protocol? If the resident reacts defensively, then listen first. I understand you're pressed for time, and I will reframe my common goal saying that, hey, I'm doing this for patient and staff safety and for all of our safety. And I would offer a polite joint solution. Let's report this near miss so nobody gets hurt, and maybe remind the team at the huddle. This way, you're not really accusatory. You're not really trying to escalate things. It's a corrective behavior because the amount of response you give should be proportional to the behavior. So you don't want to go too aggressive here either. And depending on how severe this is, you may want to also have to, if they're not willing to report this with you, you might have to go and then report that on your own to the appropriate staff so this doesn't happen again, because it's a safety concern. So in reflection, when you're reflecting this, essentially this scenario reinforces your duty to advocate for everyone's safety, patients, hospital staff, and to address errors respectfully, not hastily, not out of judgment, even with senior team members. That's very important. A lot of times people just get scared because if it's a senior team member in real life and also in CASPER scenarios, but you need to have a diplomatic, polite, non-judgmental way to be able to address pressing issues, whether it's somebody senior or junior, at all times. Safety of people always comes first. Just remember that. And this is how you answer a difficult CASPER scenario based on the BMO method.